According to medical experts, some hormonal changes in women after childbearing can actually affect their physical and mental health when they attain old age. But as you're about to find out in this report, proper care for the elderly, regular exercises, and indeed healthy diet can actually go a long way in addressing this maternal health challenge. Studies indicate that childbearing does have some effect on the physical and mental health of women when they attain old age. For instance, certain levels of depression in women have been tied to childbearing. Some experts also hold the view that the number of children a woman bears and the age at which she stops to bear influences her willingness to pursue any physical fitness exercise or even maintaining her economic and social status.
You know that in the postpartum period, that's immediately after childbirth, there are some hormonal changes that may predispose some people to develop mental health problems, for example, depression. What is more important is getting adequate and prompt help when there's a problem.
Because of their hormones too, they also have issues when they are pregnant. They could have mental disorders. They have issues when they want to deliver, like we have in postpartum disorders. And they also, during hormonal change, during puberty, that's when they start to menstruate, and also when they stop menstruation, menopause. So there are many hormonal factors that make women to maybe experience mental issues much more than men.
Childbearing age. Now responsibilities of the woman. She's the one that the family comes back to, and then because of endocrine system, maybe disturbances during childbirth, then the woman, you have more women having postnatal psychiatric problem, postnatal blues, postnatal psychiatric disorders.
80-year-old Florence Okwanata Uwezoke is down with dementia, a health condition that causes a decline in memory, severe enough to reduce a person's ability to perform everyday activity. She is now being cared for by her daughter, Comfort, who describes the task as daunting in the face of current economic realities in Nigeria.
It has never been easy, being that she has loss of memory. Somebody has to do everything for her, feed her, bathe her, change her clothes. You know, she needs adequate care. She needs special care. So she does not eat as we eat. So you see that the income in the area of finance, she takes more, and some other things will suffer.
Florence is lucky to have a caregiver, as several aged women have died out of frustration and hardship due to lack of care, while some others have no place to call home. In Lagos State, for instance, there are only about 2 privately owned old people's homes and 1 owned by the state government, with limited bed space to accommodate the aged women. A staff of the home who spoke off camera said there would be no vacancy until one of the senior citizens dies. This, no doubt, poses a great challenge. There are, however, other aged women who, despite their age, are still in good physical and mental health, a status they say couldn't have been attained without a healthy lifestyle.
So you have to eat the right food, not go and be delving in too much carbohydrates, which then sits on the stomach, and then it's very difficult to get rid of. So that is how I have been able to do that. Every pregnancy I've had, I've gone back to normal. So as I now got older, you know, I'm able to maintain, you can never fight age, you can never be as slim as you were if you don't have that propensity, but at least you'll be healthy, you'll be energetic, and you know, you'll still look good without trying so hard to be in competition with the younger people.
After the childbearing, normally we have estrogen and progesterone that help you during the pregnancy and during the childbearing. But after childbearing, you don't have this anymore. And once this one is diminished in the body, women suppose, start complaining of pains here, pains there, knee joints, all this and that, because they don't know what to do, in fact. So this can give them a lot of problem. They may be thinking that maybe it's, disease, or maybe somebody is doing them, maybe they've matched or something. So you know what to eat, then you know what you should do, and exercise. Because exercise is a major thing after the childbearing. Once you are doing exercise, if you don't sit down in one place, if you move about, that gives you privilege. And if you know what to eat after childbearing, because you don't continue using any junks. You eat fresh things and not processed food. Processed food even give problems to people after childbearing, because because of the toxic inside the tin food or whatever. So you have to base yourself on fresh food mostly that you take, and then drugs that will put you up, like vitamins, like fish oil. So you have to know how to take the fish oil, and then calcium, all these things, and then like vitamin B, because of your nerves. Or you need your nerves to be relaxed. So you take the vitamin, you take this vitamin B, all sorts of vitamin B that can mix together. You can take them. Then you can take them in fruits too. When you have fruit, take a lot of fruit. When you take a lot of fruit, so it helps you.
They would, however, want to see more government intervention in the care for the elderly, as obtained in other climes.
People whom here have visited the place, the way they are taking care of them is nothing to really write home about. Because they have to give them all the relaxation things that they can have to relax them and to feel like home. Yeah, they have to make it to be like they are in their proper home. So that one is not there. If you have a private home that can take care of them, that they feel like they are in their home, and they have everything facilities that you use there, it will be better off if government can arrange for this.
Our counterparts abroad, once you hit 60, you receive most benefits, either 50% or you just pay a token, 20-25% on the train, when you go to pay your bills, when you go to your electricity bills and all those kind of things. Once you can show that you are aged, you have so many little things, but it's not so here. That's one of the things the government has to put in place.
But there appears to be a ray of hope, as the Lagos State government says it has concluded plans for the establishment of modern community day care centers for the elderly in the 3 senatorial districts to further boost their welfare and interactions. The state governor, Akiwumi Ambode, who stated this at the commemoration of the 2017 International Day of the Older Persons, expressed his administration's determination to continue to engage older persons in his government's policies and programs to achieve positive growth and development. Experts, however, say women can overcome postpartum and postmenopausal depression and anxiety if they avoid sedentary lifestyle, engage in regular exercise, and eat healthily.